Hi, my name is Yana Sanchez, and my team is made by Camilo Ayala and Camila Tuñas, and we're going to talk about capsid inhibition with lenacapavir in multidrug resistant HIV-1 infection. Talking about the background, we have that the patients with multidrug resistant human immunodeficiency virus type 1 infection have limited treatment options. Lenacapavir is a first-in-class capsid inhibitor that shows substantial antiviral activity. And with the hypothesis we have, is lenacapavir useful as an antiviral treatment for multidrug resistant HIV-1 patients? And the objective is to examine the efficiency and safety of lenacapavir in patients with multidrug-resistant HIV-1 infection.
The type of design used was a two-cohort design. Cohort 1 were patients who experienced less decrease in HIV-1 RNA level, and Cohort 2, patients who experienced a better decrease of the virus. Patients in Cohort 1 were randomized in a 2-to-1 ratio to receive either oral lenacapavir or matching placebo during the functional monotherapy period. The trial proved the efficacy and safety of lenacapavir as a potential treatment for HIV-1 infection. The primary efficacy endpoint was the percentage of patients in Cohort 1 achieving a reduction of at least 0.5 log 10 copies per millimeter of plasma HIV-1 RNA viral load by the day 15. Secondary efficacy endpoints included the percentage of patients with viral loads below 50 copies per millimeter and below 200 copies per millimeter at week 26. The sample size for Cohort 1 was 36 patients, with 24 patients receiving lenacapavir and 12 patients receiving placebo. The sample size calculation aimed to provide a power of more than 90% to detect a significant difference between lenacapavir and placebo groups regarding the primary efficacy endpoint. The primary outcome was the proportion of patients in Cohort 1 achieving a reduction of at least 0.5 log 10 copies per millimeter in plasma HIV-1 RNA viral by day 15. Secondary outcomes were included the proportion of patients with viral loads below 50 copies per millimeter and below 200 copies per millimeter at week 26, as well as changes in viral load and CD4 count. Safety outcomes were also assessed for all patients who received at least one dose of lenacapavir. The study was from November 2019 through January 2021. They enrolled patients at 42 investigational sites in 11 countries. Eligible patients were 12 years of age or older and had received a stable failing drug therapy for at least 8 weeks, with documented resistance to at least 2 antiretroviral medications from at least 3 of the 4 main classes, and to no more than 2 fully active antiretroviral drugs from the 4 main classes that could be effectively combined.
Well, talking about results, efficiency. The percentage of patients in the randomized cohort in whom the primary efficacy endpoint occurred was more significant in the lenacapavir group than in the placebo group. Safety. In both cohorts, injection site reactions were the most common adverse events. Most were mild and resolved within days. Nausea, diarrhea, and constipation also occurred in some patients and were usually mild. In both cohorts, lenacapavir-related capsid substitution was associated with decreased susceptibility developed in 8 patients during the maintained period. 1 patient died because of the mutation and a lack of active agents needed for the therapy. Evaluation of the results and discussion. Resistance obtained in the trial warrants further investigation, given that some patients had viral load suppression while continuing to receive lenacapavir despite emerging resistance and minimal or no change in the optimized background therapy. Taking into account that this trial includes limitation like its small sample size and limited follow-up, However, new treatments options for patients with multidrug resistant HIV-1 infections are needed. Here are all references, and that's all.